Welcome to the Good Sam University virtual class. My name is Melody Butler. I am a registered nurse and infection preventionist here at Good Sam Hospital. I'm going to be talking to you today about adult vaccinations and what vaccines you and your family members may or may not need. When we think about vaccines, many of us envision kids getting back to school shots or maybe your yearly flu shot. But there's a lot more to it. Many of us do not realize that vaccination is as important for adults as it is for children. There are many infectious diseases and other viruses that can easily spread from person to person that are vaccine preventable. Today, we'll be talking about why adults need vaccines too, and why we as a community need to pay very close attention to our vaccination rates. So today we'll be discussing what do vaccines do, what vaccines do adults need, the top 5 reasons adults need vaccines, where can adults get recommended vaccines, and I'll be providing resources for you at the very end. So for our first topic, what do vaccines do? Well, vaccines protect you from diseases. Many of them are infectious. They protect anyone you come in contact with who cannot be vaccinated. That includes very young children and people with medical conditions. When vaccines work, what happens? Well, do we appreciate what we're seeing in the community? Vaccines are our best weapon at preventing infectious diseases and other viruses. And that means it's protecting not only your family, but it protects children, friends, co-workers, basically anyone else in our community. But let's be honest here. When vaccines are working in our community, what happens? What do we see? Well, we're supposed to see nothing. We're not supposed to see any infectious diseases, and we're supposed to go on with our lives like we normally should. But do we value that? Do we value the non-existence and the non-worry? We don't have polio here. We don't have to worry about your tetanus outbreaks or measles outbreaks or children coming in with tetanus infections. But we have seen when our communities have become disrupted, we have seen when we've had measles outbreaks, whooping cough or pertussis, meningitis cases, but do we really appreciate the gift of prevention that vaccines give to our communities? So if we know that vaccines work, and we know that we value their productivity and how important they are, what is the main reason more adults aren't vaccinated? Well, it's because they're largely unaware that they should be seeking vaccination. While there are many reasons why more adults are not getting vaccinated, the biggest reason is that most are simply unaware that they should. It is in our best interest as adults to take charge of our own preventative health care by learning about recommended vaccines. Adults do need vaccines to protect against a number of common and serious diseases. Protection from some childhood vaccines may not last. There may be need for boosters. And there may be other diseases that adults are at risk for due to age, occupation, lifestyle, health conditions, or travel. Every year, vaccine-preventable diseases claim the lives of tens of thousands of adults. While childhood vaccination rates are high, most adults don't know that there are vaccines recommended for them. They might know about the annual flu shot, but they don't know much about the other vaccine-preventable diseases that affect adults. But this is slowly changing, and we at Good Sam, we're doing our best to educate our patients and our communities to make sure that they know what vaccines can protect them from the serious diseases. What vaccines do adults need? We may not be aware that we need to be vaccinated, or we may not have been told by a healthcare provider to get vaccinated, but on the CDC website, New York State Department of Health, it is very simple and easy to find out what vaccines are recommended for adults. The following chart have some listed recommended adult vaccinations depending on age, healthcare condition, immunization status, or other risk factors such as a job or a particular lifestyle. But all adults need a yearly influenza vaccine, recently as recommended by the CDC, a COVID-19 vaccine. Every 10 years or so, every adult should be receiving a tetanus or Tdap vaccine. And women should receive the Tdap vaccine each time they are pregnant during the 3rd trimester. All adults should receive the zoster vaccine at age 60. And, depending on your medical history, 1 or 2 pneumococcal vaccines at age 65. You'll see in the chart there are additional vaccines, such as meningococcal, chickenpox, varicella, HPV. So depending on your history, depending on whether or not you received these vaccines or had these illnesses as a child in the past, you may or may not need all these vaccines, but it is imperative, so important, that you talk to your healthcare provider to make sure you have every vaccine that you need to keep yourself and your family safe. So what are the top five reasons adults need vaccines? Well, number 5, many adults may not be protected by vaccines they received in childhood, or perhaps you weren't fully immunized as a child. Booster doses for some vaccines, such as pertussis or whooping cough, are recommended to remain protected. We are living longer than ever before. For example, 1 in 5 Americans will be 65 years of age by 2030. As a result, as we age, our immune systems weaken, making us even more vulnerable to infection. Older adults are higher risk for contracting and developing serious complications due to flu, invasive pneumococcal disease, and shingles. And if you look at the graph on the left hand of the screen of the PowerPoint, you'll see that with initial vaccines, there is a bump in your protection, but after you receive boosters or a series of vaccines, your protection against some of these diseases remain even higher. Number four reason adults need vaccines. Many adults with healthcare conditions are highly vulnerable to vaccine-preventable diseases. Adults in these categories may include pregnant mothers, those with asthma or heart-lung disease, diabetics, and those with HIV, weakened immune system, or liver disease. Also, patients who have recovered from cancer or who are undergoing immunosuppressant medications and therapies. These are adults and members of our community that need additional protection. And if you're a healthy individual, the best way you can help these members of your family, your friends, and your loved ones is to get vaccinated yourself, so you have lower risk of transmission for them, and they have lower risk of catching these diseases. The third top reason adults need vaccines: getting immunized protects not just you, but other vulnerable people in your community as well. Like we discussed, babies too young to be vaccinated, older grandparents and family members, and co-workers who can spread germs to others. As we age, our immune systems weaken, like we said, making us more vulnerable to infection. A very popular and well-known public health advocacy act that we try to employ here is making sure that family members know that when there's a new baby in the family, that everyone needs to make sure they're up to date on their adult vaccinations. So not only does that include the flu shot, but it also includes the Tdap, which provides protection against pertussis. Pertussis can be a very dangerous disease for newborns. So by creating a safe environment for the baby to be in when their caregivers are vaccinated, you provide a level of protection to the child so they do not have a risk of contracting pertussis. The second reason adults need vaccines: vaccine-preventable diseases are expensive. Being sick with the flu can last up to 15 days and can cause adults to miss an average of 6 work days. Adults who get hepatitis A lose an average of 1 month of work, and adults are, in general, I know I speak for myself, but many others as well, we're too busy to spend time getting sick. As a mom, as a parent, as a nurse, I don't have time. My responsibilities, my activities, I want to be able to travel. If you get sick, that affects all of that and more. And a really good reason to be vaccinated, it's recommended by the nation's top doctors. Vaccines are safe and they are effective, but vaccine-preventable diseases kill tens of thousands of U.S. adults each year. Most adult vaccines are covered by private insurance, and those 65 years of age and older are eligible for Medicaid. Adults without health insurance, they can visit www.healthcare.org or contact their local health department for information about vaccine coverage. Vaccines play a vital role in helping the immune system and keeping adults healthy, just like eating wholesome foods and exercising regularly. When we don't vaccinate, though, that can cause very sad situations and be very dangerous. And some quick facts about what happens when people aren't vaccinated. Just as a reminder, for example, influenza, there can be a range from 3,000 to 49,000 deaths a year. Influenza can cause over 200,000 hospitalizations. We discussed pertussis. In recent years, we've seen as much as 28,000 cases a year. We need to make sure that pneumococcal vaccines are being recommended and people are asking about them and they can receive them, because in recent years, pneumococcal has caused 4,000 deaths. And we see these diseases time and time again when people forget, or they're unaware that they need booster shots, or they're unaware that they're a candidate, and then the diseases rear up in our community, and unfortunately, by that point, it may be too late. So where can adults get recommended vaccines? Well, your physician's offices, pharmacies carry a large portion of these recommended vaccinations, health clinics supported by the county and state Department of Health, workplaces. A lot of times workplaces will have flu shot drives and campaigns to vaccinate their employees, the public health department, and if you need to search, you can use what's called the health map, which is vaccine.healthmap.org, which can help you search for the necessary vaccines that you're looking for. And also, if you're looking for more information, you can call Good Samaritan for seasonal vaccine clinics and opportunities. You can call at 631-376-4444, or you can visit the Good Samaritan website to see ongoing community efforts to vaccinate members of our community. But these are all some ways to get vaccinated, and when you speak to your healthcare provider, if they don't carry the vaccine there in their office, they can definitely give you recommendations as to where to find the vaccine that you need. And some additional resources, if you want to find out more information about the vaccines adults need, you can check this website for the CDC. I provided links here for the American College of OBGYNs, where if you're a pregnant mother or you are going to be caring for a newborn, the recommendations and why it's important for adults to be up to date on their vaccines when caring for young infants. I provided information for you to look at the Immunization Action Coalition, a great resource, National Foundation for Infectious Diseases, and Vaccinate Your Family. If you're looking for guidance on how to convince your grandmother or your husband or your spouse on how to get vaccinated, Vaccinate Your Family has some great resources for you to utilize when advocating for your family and community. So, as a reminder, if you're vaccinated, please remind your family, your loved ones, and your coworkers about the importance about being up to date on adult vaccines. Don't let others go without this important health benefit. The bottom line is that we all need to vaccinate, we all need to work together, and we need to educate ourselves about which vaccines are right for each of us. And we need to make sure that we are encouraging others in our life, our family, our workplace, and community to learn more. Because the more people who are vaccinated, the less disease we see, and the happier and healthier we will be. For more information, please call 631-376-4444 or visit good-samaritan-hospital.org. Thank you so much for joining us today to learn about adult vaccinations, and I hope to see you all soon. Thank you.